How many patients with the flu have you seen this flu season?
Well, I myself have probably seen hundreds. Within the patient first system, there's probably been thousands. It's been a very, very busy flu season.
Is this higher than most years?
This is the highest year I've remembered. I've worked for Patient First for 10 years, and I don't have my exact numbers, but it's been worse than I ever remember in the past. I'm at a news center here in Colonial Heights, and so that's a different thing for me as well. But the busiest I remember since I've been here in the Richmond metro area.
What are the most common groups of people that come in with the flu?
Every year it's different. This year it seems to be young adults and school-age children that have influenza. We've seen some older people and some babies, and those are the people that are really most at risk. So, anybody can have it. But this year it seems to have hit the younger folks, school-age, teenagers, and young adults more so with this particular year.
How is this year's flu epidemic affecting Patients First?
Well, Patient First has been very busy with this year's flu epidemic. We've added some increasing staffing with physicians and nurses to try and keep up with the increased volume over this flu season. And we have support from our regional office as well. We're able to do flu tests here in the office with our labs. We can do x-rays here too. So everyone's been busier than usual.
What are some symptoms of the flu to look for that people might commonly overlook?
Well, the biggest symptom with the flu is fever. Most people don't overlook that because the fever causes the headache and the body aches and the sweats and chills alternating. Most people feel better once they've taken some Tylenol or Motrin. They can still have congestion, cough. Occasionally with some strains of the flu, we've seen a few GI symptoms like nausea, vomiting, some very light diarrhea, but those aren't usually the predominant symptoms. The predominant symptoms are the headache, the body aches, the fever, the chills, and the congestion.
What is it about the flu this year that's made it so widespread and powerful?
It's very difficult to say why a flu becomes from just a regional outbreak to a widespread outbreak. It may have to do with the weather and people congregating more indoors. It has to do with the time of the year it hits, whether the kids are in school or not. When the kids are in school, obviously it passes more quickly. It depends what group it starts with. So we don't really know how to predict the spread of the flu. But we know that this year was a bad one. And it may have something to do with the virulence of the flu and how strong that flu strain is, as well as how many people are immunized. The last few years we haven't had a bad flu season, and I have a feeling that some people didn't get their flu shots, and even though it's not 100%, it does prevent a lot of cases of the flu. So as people get more lackadaisical about getting their flu shots, then we tend to have a big flu outbreak. I bet next year more people are going to come in for their flu shots.
What groups of people would you most recommend to get a flu shot?
Well, the most important people to get flu shots are people that are at high risk. So people with chronic disease like heart disease and diabetes and asthma. Young children and older adults tend to be the ones with complications. So like the elderly and infants get the complications. Most people, healthy people like you or I, will get influenza and we'll get over it in a week or so. We'll be miserable, but we'll turn out okay. Those high-risk groups, like kids with asthma, tend to get the complications like pneumonia and reactive airway disease and problems. So those are the most important people, but I recommend everybody get the flu shot.
When somebody comes in with the flu, is there some kind of protocol that you guys have to treat them?
We do. When someone comes in and we suspect the flu, if they have typical flu symptoms, we'll go ahead and get the flu started, the flu test started as soon as they get to the back. And so our nurses are able to triage that so that when we, the doctors, come into the room, we have the results from the flu test. We combine that with our clinical diagnosis to decide how to treat the patients.
What can you advise members of the community to do to prevent the flu?
Well, the most important thing is hand washing. Flu is spread person to person, so when you're shaking people's hands, if they've coughed or sneezed into their hand, you can have it. Coughing or sneezing into a tissue or into your sleeve helps prevent that when you're touching a lot of people, but the most important thing is frequent hand washing. Hand sanitizer does substitute if necessary, but the biggest thing is that if you think you have influenza, please don't go out around people. Keep your children home from school. Don't go to work. Go to the doctor if you need to, but the best advice I have too is to just stay home and not be out in the public shopping and going to school where you're transmitting that to other people.
Is there a certain type of strain of the flu this year that was different than last year?
It's primarily type A this year, but we have seen some type B, which may have something to do with why we're seeing so many cases, because we've actually had 2 strains this year, but predominantly it's type A.
Is there anything else you'd like to add?
You know, treatment of the flu is a medication called Tamiflu, which we currently use. It shortens the course of influenza. It's not like an antibiotic that you have to take if you get the flu. For some people, it's worthwhile shortening the course. There are some side effects and things, so we don't always use that. And Tamiflu has to be started within 48 hours. And a lot of people don't realize that. They come in with the flu 4 or 5 days into it. There's not a lot we can do other than treat their symptoms.
I think that is it.